Hi, my name is Theresa Webster, and I'm here to talk about some exciting research going on at the University of Scranton, specifically with impact, exercise, vestibular eye therapy, the evolution of concussion treatment. Some personal background: I am from Bucks County, Doylestown, Pennsylvania. I'm the oldest of 6 children. 2 of my sisters are also in college, but the rest are younger. I started at the University of Scranton in the fall of 2014 with majors in Neuroscience and Hispanic Studies, along with a minor in biochemistry. I'm a pre-medical student and currently applying to medical school, and I'm also a member of the honors program. And my research for the honors program will be the focus today. The inspiration for my project began at the age of 10 years old when I sustained my first concussion in a soccer game. I do not remember what happened, but from what I've been told, I was tripped, fell backward, and smacked my head on the ground. Some of my hallmark symptoms included a headache, nausea, dizziness, and an inability to concentrate and complete schoolwork. Thankfully, I was only in 6th grade at the time, so missing so much school was not as big of a problem as it could have been. A concussion is considered a type of traumatic brain injury. It can range in severity depending on the duration of your symptoms and the symptoms themselves. So for my symptoms, I met with a nurse practitioner at CHOP. And she gave me various prescriptions in order to treat those symptoms and told me to refrain from all types of mental and physical activity. And this was a big change, going from attending school, Irish dance, soccer, basketball practice, to all of a sudden spending almost 24 hours a day on the couch. In addition, part of my treatment involved discussions of the removal of a portion of my skull in order to reduce the swelling and decrease my headaches. And this was because it had been 5 months post-injury and I was still having symptoms. Thankfully, this did not happen, and 6 months later I was cleared. I had additional, more minor concussions throughout high school from both soccer and basketball, remained relatively symptom-free, and was able to return to daily activity. As a junior in high school, I had a soccer-related concussion that involved a time period of about a month of recovery. I was not the best patient at the time, and went to the appointment with my pre-calculus homework, and my nurse practitioner was not thrilled. It was evident that I did not recognize or want to accept the severity of these injuries, or even recognize it as a type of brain trauma. As a senior in high school, I had 2 additional soccer-related concussions in a time span of a month. This is because I returned too soon to play following the first injury, ignored the obvious symptoms, and attributed them to not getting enough sleep. It was at this time that I decided to stop playing club soccer and to stop playing high school soccer following the completion of my final season. And this was done at the urging of my nurse practitioner and family, who were concerned about the ramifications that these injuries would have on me later in life. And at this time, I started to listen to them. One of the reasons being that I had balance difficulty, a symptom I'd never experienced before. However, in my first appointment post-injury, I was unable to walk in a straight line backward with my eyes open. Something simple, but I could not do it, and it was because of these injuries. So it was at this time that I developed an interest in neuroscience, partially due to my own experience, and partially due to the frequent news articles and press releases about the NFL and how they were handling the injuries of their past and current players. The first player who sparked this conversation about concussions was Mike Webster. He was a center for the Pittsburgh Steelers, 4-time Super Bowl winner, and Hall of Fame member. So quite an impressive player. However, he was also the first player to be diagnosed with CTE in 2002. CTE stands for chronic traumatic encephalopathy, and it is believed to be due to the death of neurons following traumatic brain injuries such as concussions. Dr. Bennett Omalu made this diagnosis. He is a forensic pathologist and neuropathologist, and he did this autopsy study of Mike Webster when he was at the University of Pittsburgh. The clinical findings of this autopsy included aggregated tau and TDP-43 proteins, along with atrophy of the cortex, basal forebrain, mammillary bodies, and hippocampus. This case was actually presented in the movie Concussion that starred Will Smith, and since Mike Webster's diagnosis, there have been multiple other NFL players to also receive a CTE diagnosis. So at this point, I realized that I had wanted to do a project in brain trauma, specifically with concussions, but was unsure where to go. So I reached out to my advisor, Dr. Waldeck, who was open to the idea of exploring the field of concussions through a tutorial. So we made plans for a tutorial in the fall of 2015, which first involved examining articles written by Dr. Bennett Omalu about the identification of the abnormal proteins and atrophy of the brain in CTE patients, and then moved also to the symptoms and treatments of concussions. Thankfully, while I had this tutorial, I also had the opportunity to speak with Dr. Hakim. Dr. Hakim is the director of the Doctor of Physical Therapy program at the University of Scranton. She also has neurological research interests. So prior to the start of my tutorial, I met with her when she gave me guidance on literature to read and also how to differentiate my project from what has been done before. Following the completion of my tutorial, I met with her again, and we solidified the idea of a post-concussion case study. In addition, she also provided me with a contact, Dr. Perry Koslow, who is a graduate of the Doctor of Physical Therapy program at the University of Scranton, and also the Vice President of ProCare Physical Therapy. So it is with ProCare Physical Therapy that I will be completing this research. As my title of the presentation alludes to, there has been an evolution in the treatment of concussions. Previously, as with my first concussion, patients were told to refrain from all types of mental and physical activity until you were asymptomatic for at least 1 week. And that is because this first 7 to 10 days after a concussion is considered the metabolic vulnerability period. The cerebral blood flow and autoregulation are disturbed, so any increases in heart rate, such as while exercising, can exacerbate the symptoms. However, John Leddy in 2010 did a study on post-concussion syndrome patients, and these are patients who are symptomatic following a concussion at least 1 month post-injury. He was evaluating the use of aerobic therapy as a treatment for these patients since he believed that the complete absence of any type of physical or mental activity was actually resulting in altered autonomic function and cerebral regulation. And his results did show that the patients who performed exercise had shown improvement on their cognitive test scores, such as IMPACT. IMPACT is a neuropsychological test that was developed at the University of Pittsburgh that tests brain and memory functions that can be altered following a concussion, such as your memory, reaction time, and speed. In 2012, John Leddy did a follow-up study, again with these post-concussion syndrome patients, and again evaluating the use of aerobic therapy as a treatment. However, this time not all the patients showed improvement on their cognitive test scores. And he hypothesized that this was due to the fact that post-concussion syndrome is related to other non-blood flow related factors, such as migraines and ocular tracking. Now, since my project involves a case study of a human patient, I did complete the IRB process. So I first met with Dr. Miller-Scandal in the May of 2016 in order to discuss the requirements. Then that summer, I completed the mandatory online training and prepared the forms detailing the background and methods of my project. I first submitted the forms in October and then resubmitted them in December and January with minor tweaks of language in order to finally receive approval in January. With regard to the status of my project, I am still working with ProCare Physical Therapy, and I'm currently waiting for a patient who meets 3 criteria. The 3 criteria include that the patient is 16 years old, with 0 to 1 previous concussions, that the patient has an IMPACT baseline prior to this concussion, and that the patient has at least 3 concussion symptoms for 3 weeks following the injury. The treatment of this patient will then begin 3 weeks post-injury, as exercising sooner than 2 to 3 weeks can be harmful to the patient. It will also involve the IMPACT test in order to compare their baseline and post-injury cognitive scores. And what differentiates my project is that it will involve a combination of aerobic and vestibular eye therapy. And this is because John Leddy had hypothesized that post-concussion syndrome may be due to not just blood flow related factors, which can be alleviated through aerobic therapy, but also other factors such as ocular tracking, which is what vestibular eye therapy works to correct. I myself completed vestibular eye therapy in the summer of 2016, as I was still suffering from headaches even though it had been almost 2 years since my most recent concussion. I also have some additional questions since the completion of my IRB forms, and one of them is about the use of a vitamin regimen. There is currently a study at Thomas Jefferson University with Rothman Orthopedics evaluating the use of a vitamin regimen previously prescribed to migraine patients that could now be prescribed to concussion patients. And this again goes back to what John Leddy had hypothesized, that post-concussion syndrome may be due to non-blood flow related factors such as migraines. The vitamins that they are specifically looking at include vitamin B2 or riboflavin, magnesium, coenzyme Q10, and the omega-3 fatty acids. Thank you for watching, and best of luck with your research.